Hello. Workers warn cuts to the budgets for mental health care could cost lives.
Hundreds of jobs will go at the Norfolk and Suffolk Foundation Trust. It looks after 36,000 people each year, but it needs to save £40 million. Bed places will be reduced by 20%, and now it's emerged the Trust's new chief executive won't be appointed until next year.
When Andrew Day's mother died in June, his younger brother suffered a mental breakdown. Richard Day from Norwich was given a bed in Surrey. He's now being treated in Bury St Edmunds, a 100-mile round trip. Richard's brother, who has cerebral palsy, is grateful for the care, but would like him closer to home.
What's happened to my brother could happen to anybody. I honestly believe that if my brother had been to the hospital, he would not be around today.
This woman, who's worked in mental health care for 7 years and wants to remain anonymous, says the lack of leadership and job cuts is affecting everyone.
The government needs to realise you can't cut this money because it will cause people to commit suicide. The staff shortages are putting us under pressure all the time. The people we look after are under stress. You know, you feel choked up when you leave that person, how vulnerable they are.
I think the trustees, the mental health trustees, need to go back to the clinical commissioning groups and the Department for Health and say we cannot deliver these 20% cuts and guarantee patient safety.
The cuts are being made over 4 years. In the first year, the Trust has told us that 41 people have already been given compulsory redundancy. 21 have taken voluntary redundancy. 79 others have been told they can apply for other posts in the Trust. In total, 400 jobs were expected to go through natural turnover. The Trust says it's hoping to reduce that number, but Unison says the service has already reached breaking point.
People are reporting to us in our crisis teams and approved mental health practitioners who go out and assess people under the Mental Health Act that quite often they can't find a bed locally. If they can find a bed within our trust, it might be someone from King's Lynn being admitted to Great Yarmouth, or recently we've had people being told the nearest bed is as far away as Somerset, Sussex, or most recently Glasgow.
It's finding ways of stripping out costs so that we can meet the extra demand. It's not cutting the budget, absolutely not.
Andrew Day hopes his brother will soon be treated closer to home. Meanwhile, the search for the Trust's new chief executive continues, and according to the union, so does the pressure. Debbie Tubby, BBC East.
Well, late this afternoon, I spoke to the interim chief executive of the Trust, Andrew Hopkins. What did he have to say about those warnings that people could die because of the cuts being made?
These are services that have been designed by the Trust's senior doctors, clinicians, psychologists and nurses. So we've looked at how can we provide mental health services over the next 4 years in a safe way, that provides a good level of service to the 36,000 people that we see every year in the Trust with mental health conditions.
But you have already had, in just 1 quarter of this year, 20 unexplained deaths within the area that you cover.
We're doing a significant review of those 20 cases. There is nothing that has come out of the early work on that review that suggests that they are connected to the changes. Every year, every mental health trust will have a lot of incidents, a lot of serious incidents, a lot of unexpected deaths, and there is nothing in there to link that to the way in which the trust service strategy has been designed or implemented.
400 job cuts, though, over the next few years. That is an enormous amount of people to lose. Do you think that your service is a second-class citizen in the health service?
I do think that mental health historically has not had the same level of funding that has gone to other healthcare services. As a good example, I think it was last year, nationally, the amount of spending on mental health went down.
And what your staff are saying is they'd like you to stand up to the government that is imposing these cuts and say, we can't do this, it is not safe and it's not workable.
I think if we genuinely thought that was the case, then I would be saying that. At this point in time, with the work that's gone on, as I said, by very, very senior clinicians, signed off by our most senior nurse and most senior doctor, we believe that this service can work.
But there are a large number of patients who are moved out of the Norfolk and Suffolk area, even up to Scotland or Somerset, and surely this isn't good for them or their families.
It is not an ideal service to have to send people out of county or as you say, much further afield, that is not the sort of service that we would want to provide.
But isn't that a case of not enough beds, and there are going to be even fewer beds in future?
Our acute doctors are of the opinion that with better discharge planning, better discharge arrangements, closer working with social care around discharges, and maybe providing some alternatives to admission, that we can run with the beds that we're proposing. I would accept at the moment there is a problem with this. We have said all along, as we go through the implementation, that if there are quality concerns, if there are safety concerns, if we're worried about parts of the service, we need to review what we've been doing. And I think part of that review is about the staff telling me, telling the trust about what they think is wrong.
Whistleblowers have nothing to fear.
We absolutely encourage it, yeah.
Andrew Hopkins, thank you very much.
Thank you.